Hi there, my name is Dale Gallagher. I am an oral and maxillofacial surgeon. TMJ just means temporomandibular joint. It is an anatomic description of the jaw where the lower jaw, the mandible, articulates with the socket, which is called the temporal bone, at the base of the skull. It just means jaw joints. That's what TMJ is. It's just jaw joints. TMJ is also a general slang term that refers to something that is wrong with the jaw. TMJ can refer to problems with the jaw that may be jaw pain, jaw popping, jaw locking, or other symptoms. To be concise, when someone tells me that they have TMJ, it really doesn't tell me much. Saying I have TMJ is like saying I have elbow or I have knee. Rather, it is better to be more accurate and say I have pain in my TMJ or my TMJ pops. The lower jaw is called the mandible and it moves. The socket part of the TMJ is the temporal bone, and it does not move. The mandible is the only bone in our body that has the same joint on both sides and has teeth. The maxilla is the upper jaw, and it also has teeth. The TMJs, or jaw joints, the way the teeth come together and mesh, the bite, and how the maxilla and mandible are aligned, the bones, all must function in harmony. All three structures, the joints, the bite, and the bones, must be evaluated separately, as well as together when determining problems of what may be wrong, what needs to be fixed, and the sequence of treatment that may be recommended. Let's look at the parts of the TMJ and how jaw movement occurs. The TMJ is comprised of several structures as well as the mandible and temporal bone. Between the mandible and temporal bone, there's a disc, just like there is a disc between the bones of the knee. The disc acts as a sliding and lubricating surface between the bones as they move. The TMJ also has muscles, it has ligaments and nerves, as well as other parts that we will discuss in another presentation. When the TMJ moves, the condyle of the mandible, that's the top part of the lower jaw that goes into the joint, both hinges, means it rotates, and it slides. Now let's look at a cadaver dissection of the TMJ so you can see what this really looks like. Here's a cadaver dissection showing the TMJ. Note that there are many anatomic structures in and around the TMJ. The TMJ is located immediately in front of the ear. In fact, the sensory or feeling nerves that go to the TMJ also supply feeling to the ear canal. That is why it is common to have both ear and joint pain from disorders of the TMJ. It's sometimes hard to figure out which is which. The facial nerve passes superficial to the TMJ and moves the muscles of facial expression. This is the nerve that helps us smile, frown, show our facial emotions. Suffice it to say that the TMJ is a complex structure and is intimately related to the way the bite and jaw bones are aligned and function. Here are common symptoms of TMJ disorders. Please note that these are descriptions of symptoms and tell us very little about the anatomic problem that caused the symptoms. TMJ symptoms occur because of anatomic and physiologic problems, generally called disorders and deformities. Common TMJ anatomic deformities and misalignments include torn ligaments, dislocated discs, and arthritis of the bones. Think of the TMJs as orthopedic structures, just like the knees. If your knee was painful, popped, and you had trouble walking, would you tell other people that you have knee? No, of course you wouldn't. So communicate accurately by saying, I have pain in my TMJ pops, or my TMJs hurt when I chew. These are more descriptive and accurate. Now you know the meaning of TMJ and how to use the term correctly. If you like this presentation and would like to learn more about TMJs and how the jaws work, check out my other videos. I wish you the best for your future jaw health and happiness, and check us out at our webpage too at jawpain.com.